We're really excited to be joining this group today. On behalf of the NIH All of Us Research Program, we're really excited to share our stakeholder feedback model with this group. On slide 2, we have provided our credentials and our contact information. My name is Jennifer Shelley. My pronouns are she and her. I'm a white cisgender female with light brown shoulder length hair. Today, I'm wearing a green top with a white jacket. I work in the Division of Communications at the NIH All of Us Research Program, and I'm joined by my colleague, Leslie. Leslie, will you introduce yourself and kick off our presentation?
Yes. Hello and good morning. I'm Leslie Westendorf. My pronouns are she, her. I am a white cisgender female with blonde hair that is pulled back today. I'm wearing glasses and I have on a light blue sweater. I work in the Division of User Experience at the NIH All of Us Research Program. Slide 3, please. So today we will share a model for collecting, prioritizing, and implementing stakeholder feedback. And this model is based on our experience of engaging stakeholders to responsibly return DNA results to a diverse community of research participants. We reflected on lessons learned throughout our experience to develop this model for a more intentional, cohesive approach. Slide 3 here depicts a circle with 8 sections. Each is a different color. The sections are plan, recruit, collect, document, prioritize, implement, close the loop, and measure. Arrows go clockwise around the phases to indicate that this is not a linear process, but a continuous cycle of stakeholder engagement. We will use this same graphic on several of the following slides. In this presentation, we will discuss methods, how to apply the model, lessons we've learned in our experience, and some early signs of success. Slide 4, please. So before we begin, let's start with a quick review of the NIH All of Us Research Program. Slide 5, please. Slide 5 here describes the mission of All of Us, which is to advance research in precision health so that one day healthcare can be individualized for all of us. To do this, we're asking 1 million people from across the country to join and share their health information. And researchers will use this information to conduct studies of all kinds to speed up health discoveries. This slide includes a photo of Dr. Francis Collins, who is the former NIH director. Slide 6, please. The diagram on this slide summarizes the All of Us participant journey. To join, participants will create an account, they sign consent, and then they get to choose what information they want to share with us, such as health surveys, physical measurements like height and weight, and blood or urine samples. One specific way that we aim to return value to participants, which is unique to our research program, is by offering them the choice to receive personalized DNA results. This includes 2 different types of health-related DNA results. 1, hereditary disease risk, and 2, medicine in your DNA. For many participants, this is a primary reason to join All of Us, and therefore these results are much anticipated. Slide 7. Since the launch of All of Us, which we just celebrated our 5-year anniversary, more than 600,000 people from across the US have enrolled in our program, and 80% of those identify with a community that has historically been underrepresented in research. Some examples of these communities are rural communities, racial and ethnic minorities, and sexual and gender minorities, to name a few. And because of the diversity of our participants, we knew that returning something as sensitive as DNA results would involve overcoming significant barriers. Some of these barriers include trust in government and varying levels of health literacy. We could not begin to address these challenges without significant input from participants themselves, which, not surprisingly, was a key stakeholder group in our work. Slide 8. In addition to participants, we expanded our stakeholder group to include representatives from various partners who are awardees of the All of Us Research Program. And throughout the process of gathering feedback, these partners provided essential subject matter expertise at various stages to ensure that the experience of receiving DNA results was as inclusive and accessible to participants within the communities they represent. On slide 8 here, there are numerous logos that represent the 50+ partners who help spread awareness of the program and in some instances also enroll participants. Go to slide 9. Another stakeholder group we considered were staff at the various All of Us enrollment locations who interact with participants on the front lines and who often use personalized DNA results as a key benefit when describing the program. Slide 9 shows the logos that represent our consortium, which consists of healthcare provider organizations that span geographic regions from California to New England, including Veterans Affairs. Slide 10, please. So as you might imagine, you saw a lot of logos. It was super challenging to manage such a disparate group of stakeholders, from participants to enrollment staff to awareness partners who represent diverse communities. Some groups to be more hands than others, and opening the door to feedback, it was sometimes difficult to close the loop. Slide 11, please. Slide 11 here lists many of the different methods that we use to gather stakeholder input over the course of about 2 years. And during this 2-year period of launching health-related DNA results, we weren't just collecting feedback, we were also building the technical infrastructure to do so. So I just want to make that clear. But some of these reviews were required, like reviews with our independent research ethics board and the Food and Drug Administration. In our lessons learned, which Jennifer will share in more detail, we will focus on a few specific methods, such as listening sessions, usability testing, and the cultural awareness committee that we created for this initiative. Slide 12, please. So the diagram here on slide 12 represents our evolving stakeholder feedback model. Left, which we call ad hoc, circles with dotted lines connecting in all directions. There was no sense of organization in this phase. And at some point during our feedback collection process, we created an official stakeholder feedback group that consisted of representatives from various All of Us divisions, which include science, policy, communications, user experience, engagement, product, and cohort development. Within phase 2, which we call centralized, we established a process to document, prioritize, and implement feedback in a more systematic way. The illustration for phase 2 is a large circle representing the stakeholder feedback group, and from it, 3 linear steps represented by smaller circles for document, prioritize, and implement. After launching DNA results, we reflected on this process and the lessons learned, and based on those lessons in phase 3, we have now developed a model for a more intentional approach. In this diagram, phase 3 is shown as the sectioned circle with clockwise arrows as described previously. Jennifer is now going to take us through our stakeholder model in more detail and provide specific examples from our work. Let's go to slide 13.
Thank you for setting up the background for us, Leslie. This is Jennifer, and I'm going to talk through each of the phases we included in our stakeholder feedback model. Slide 14 shows the stakeholder feedback model diagram that Leslie described on slide 3. I'll discuss the 8 phases beginning with plan and ending with measure, but just a reminder that the model is intended to be applied in a continuous cycle of stakeholder engagement. For this discussion, we created 2 slides for each phase. The first slide will explain what to do in each of the phases, and the second slide will include some of the lessons learned that we think will inform your work. When I'm done, I'll hand it back to Leslie, and she will present some of the signs of the success of the stakeholder feedback project. Let's go to slide 15. So each of the slides in this section also includes a version of the stakeholder feedback model with the phase that we're discussing highlighted. So here on slide 15, plan is highlighted. So what do we do in plan phase? There's more to planning than deciding what you want feedback on. This is really your chance to get ahead of challenges that may arise during later phases. You'll want to document any baseline information and data that you have and figure out what success looks like. You'll also want to have a plan for navigating conflict because conflicting feedback will happen. Here on slide 16, we've listed some of our lessons learned from the plan. First, if you don't have baseline metrics, it will be harder to measure the impact of the stakeholder feedback. Also, if you don't know how you're going to define success, you won't know what to track. So it's really important, just excuse me one more time. Excuse me. So it's really important to put those mechanisms in place for tracking success so you can gather the right data. For example, the All of Us research program has a support center that responds to all of our participant inquiries. Each inquiry gets a ticket. After we launched, we wanted to know how many participants had specific questions about DNA results. For example, did anyone call in asking if DNA results was going to have some sort of impact on their ability to get disability insurance? Or did any of our participants have trouble figuring out how to schedule a genetic counseling appointment? Unfortunately, Support Center didn't know to code for these very specific topics, so it was a lot harder for us to get data on these types of inquiries. Another lesson we learned is if no decider is identified, it will be difficult to determine how to manage conflicting feedback when it happens. As Leslie mentioned earlier, we organized a cultural awareness committee to review the user experience for anything that might be confusing, misunderstood, or potentially offensive from a cultural context. In a couple of instances, the feedback we got from this committee conflicted with feedback we had received from other subject matter experts. So we had to scramble to figure out how to identify a decider and how to address the conflicting feedback. Slide 17 now details what to do for phase 2, which is recruit. So this is when you decide who you need to collect feedback from and to set both scope and expectations with those feedback providers. On slide 18, we've listed some lessons learned. First, start recruiting early. Depending on who your stakeholders are, it may be hard to get time with them, or it may take a while to gather feedback if you have a lot of stakeholders to talk to. Second, make the scope or your ask as clear as possible. For example, going back to the Cultural Awareness Committee, in addition to receiving really helpful cultural sensitivity feedback, several of our committee members also provided us with copy edits to the content, which was not within the scope of our request. On slide 19, we detail what to do for phase 3, which is collect. As we discussed earlier on slide 11, there are many ways to collect feedback. You need to choose which feedback method or even methods to use. Consider the number of stakeholders, the type of stakeholders, and also the type of feedback you'll be looking for. Are you looking for qualitative feedback, such as from a listening session, or do you want quantitative feedback, such as from a comprehension testing or usability testing? On slide 20, we'll talk about some of the lessons learned from collecting. First, an important lesson we learned was that interaction with stakeholders should be very bidirectional at the early stages. Then as you progress, you can shift to giving stakeholders something to react to. We learned this lesson when the communications team asked our participant volunteers to review already developed content instead of asking them what content we should be including. Second, tailor the feedback methods to the question. For example, we conducted usability testing with proxy participants and participant volunteers to make sure that participants could navigate easily between different sections of the online DNA results. And we were hoping that it was easy for them to find out how to schedule a genetic counseling appointment. Finally, a really helpful lesson we learned was to provide asynchronous feedback collection methods. We learned that some of our stakeholders really preferred to share feedback in offline mechanisms instead of in live listening sessions, or just because they thought of something later and wanted to have the opportunity to share it with us. So when you do use these asynchronous models like surveys and forums, just be sure to set deadlines. Here on slide 21, we detail what to do for phase 4, which is document. The key is to document everything, document all the feedback, and document it in a central location. Once we had created the official stakeholder feedback group, we used a shared spreadsheet. We documented when we got the feedback, who we got the feedback from, and by documenting every piece of feedback, it made sure that everyone involved in the project could see what was being shared by our stakeholders. And this is also a really helpful tool to refer back to when you're closing the loop with your stakeholders. Slide 22 lists some lessons learned for document. As I mentioned, document centrally from the beginning. And as you heard from Leslie earlier, for our project, central documentation didn't start till midway through the process. So that made it harder to organize for us in closing the loop and measuring the impact of the stakeholder feedback. We also recommend doing some minor organizing of the feedback as you receive it. So in our instance, we categorized our feedback into 4 buckets. The first one was launch blocking. The second one was needs more analysis. We also had categories for duplicate and out of scope. The duplicate category came in really handy because it helped us to see how often we received similar feedback from multiple different stakeholders. And then having out of scope as a category helped us make the prioritization phase much more manageable. So let's talk about prioritize. And this is phase 5. So slide 23 lists what to do. When prioritizing feedback, you may need to consult with others so that you can fully understand what would be required to implement the feedback. For example, if we want to make a change to the user experience, how much development effort will be required and will it affect our timelines? The lessons learned for prioritize are listed here on slide 24. It was clear that we would not be able to implement all of the feedback we received in time for launch. So we needed help. So we used the RICE scoring model. This is a prioritization model, and RICE stands for reach, impact, confidence, and effort. You can find a lot more about it online just with a simple Google search, but you also may have some prioritization models that you already use that will work for you. But using the RICE model helped us decide which feedback we really had to address before launch, which feedback we could implement after launch, and which feedback we could monitor and decide whether or not we really needed to implement it at all. The RICE model also ensured that we considered constraints like the budgets and timelines, and it also ensured that we consulted with those who would have to implement the feedback so that we made sure we understood what would be involved in implementing the feedback. Now we're on to phase 6, which is implement, and we're on slide 25. The key here is to implement, test, or launch the feedback that has been prioritized. It can be really tempting to implement non-prioritized, low-effort feedback just for the sense of making progress, and we really advise against doing that. On slide 26, we have a couple of lessons learned for implement. As we kind of referred to earlier, coordinate and communicate implementation projects across all of the individuals or teams involved in the project. For example, after we implemented some changes to the user experience, we realized that the new UX did not align with some of our communication assets. We forgot to notify the communications team about those changes. Second, you can use implementation as an opportunity to gather even more feedback. For example, we had a friends and family launch before we launched to our participants. So during that friends and family launch, we asked our friends and family to complete an anonymous survey. And this was a way for us to gather more feedback to determine whether our changes were successful. Phase 7, close the loop. We're on slide 27 now. Closing the loop is a reminder to report back to the stakeholders so they know what was or will be implemented. And it's just as important to let them know what was not implemented and why. Closing the loop is also an opportunity to ask stakeholders for suggestions on how to improve this feedback process for future projects. The lessons learned for Close the Loop are here on slide 28. In our experience, we found that many stakeholders were very passionate and thoughtful about the feedback that they gave us. So they became pretty frustrated when they didn't hear back from us right away. So we are in the process of investigating how to standardize the process of closing the loop so that we can make it more timely and so that we can give this feedback back to our stakeholders so that it will hopefully preempt these questions and frustrations. And finally, phase 8, measure. Slide 29 here lists what to do. Once the feedback is implemented, it's time to measure the impact of that feedback. This may be done by monitoring the analytics that you put in place earlier during the plan phase or another phase, or doing additional testing in the implementation phase. If you have baseline data, this gives you an opportunity to compare to see if there has been any improvement. Our lessons learned from measure are on slide 30. And as we referred to earlier, in our experience, we realized we didn't always have the baseline data to compare against. However, a lot of the measurements we could capture did suggest that the stakeholder feedback we implemented did have a positive impact on the user experience for the return of DNA results. I'm going to pass the microphone back to Leslie now, and she's going to summarize the impact of stakeholder feedback we have seen so far. And I'm going to move on to slide 31.
Hi, this is Leslie speaking again. Before we close out, we want to share a few examples that illustrate early impact of our stakeholder feedback on the launch of DNA results to all of us participants. Slide 32, please. On this slide, we are highlighting some early signs of success. So first, the comprehension testing scores that we received were near 100% for each of our health-related DNA reports. So just a reminder that participants may receive 2 different types of reports: medicine in your DNA and hereditary disease risk. Additionally, we did not receive any launch blocking comments from our Cultural Awareness Committee or during our Friends and Family launch. Slide 33, please. Slide 33 shows data from our Participant Support Center, which Jennifer mentioned takes participant inquiries. Since launching health-related DNA results, there have been about 9,500 inquiries, and most of these are from participants asking when they will get their DNA results. As I mentioned earlier, because this is a key motivation for many to join the program, participants are really eager to receive these results. So that inquiry is not surprising to us. There were very few inquiries about the DNA reports themselves, and even fewer about genetic counseling or how DNA results might impact insurance coverage. Both were topic areas we anticipated participants would have questions about. This may suggest that the materials available are easy to understand, or they're able to find the questions that they have, answers to questions they have. We continue to monitor the inquiries from our support center to guide and track and make changes to our work. Slide 34, please. On this slide, we have some promising data from participants who took a voluntary survey after viewing their DNA results. So in this chart, the blue bars represent the hereditary disease risk report and the yellow bars represent the medicine in your DNA report. Within each of these reports, there are survey modules with questions that participants are able to answer. And there are some trends here that we find interesting. So first, related to understanding, 95% of participants who received a hereditary disease risk report and 76% who received a medicine in your DNA report agree that the reports are easy to understand. But why is the hereditary disease risk easier to understand than medicine in your DNA? We'd need to conduct further research to understand the why behind these numbers. We're also really eager to see how satisfaction and trust change over time as more participants receive their health-related DNA results. These results are returned to participants on a rolling basis because they have to be reviewed and signed out before they are verified and sent to participants. So not everyone gets them at one time. Let's go to slide 34. Finally, we'd like to acknowledge the work that we presented today was definitely not ours alone. It was a team effort involving several divisions of the All of Us research program, as well as members of our partner organizations who are awardees of All of Us. And slide 36. So thank you again for your time today. Slide 36 is our last slide. We invite you to learn more about our program by visiting allofus.nih.gov. And now Laura is going to lead us through the Q&A.